Right now, somewhere in your medicine cabinet, there's a pill for a headache you probably haven't even had yet. You bought it just in case. That's normal to you. Stock the shelf, treat the symptom, move on with your day. But that instinct, reaching for something to fix your body before it even breaks, is way older than pharmacies, older than hospitals, older than the idea of a doctor as a job at all. It's older than writing, older than farming, older than most of what we'd call civilization. So the question is, if there was no medical care for almost all of human history, how did anyone survive a broken leg, a bad fever, or childbirth going wrong? How did entire villages make it through winters and plagues and infected wounds with nothing but dirt floors and instinct? Let's go back to the actual beginning. And weirdly, the beginning isn't even human. Chimpanzees, when they get parasites, will sometimes eat specific bitter leaves that do nothing for hunger and taste terrible. Researchers have watched them do it for decades. Those leaves have compounds that clear out intestinal worms. Nobody taught them that. It's instinct tested by trial and error over generations, then repeated because it worked. That's the seed of medicine. Not a hospital, a habit. Now fast forward to actual humans, and we already see it showing up in the fossil record. Scientists studying dental plaque from Neanderthal remains found traces of plants like chamomile and poplar bark stuck in the tartar. Poplar bark contains the same active compound found in aspirin. Chamomile is a mild anti-inflammatory. These aren't foods. Nobody eats poplar bark for dinner. That's a Neanderthal, tens of thousands of years before modern humans even reach Europe, self-medicating for pain and inflammation. Think about that. And it gets stranger. The famous frozen mummy, known as Otzi, found in the Alps and dated to around 5,300 years ago, was carrying two types of fungus in his pouch. One had antibiotic and anti-inflammatory properties. Researchers believe he was using it to treat parasites and infected wounds. He was essentially walking around with a first aid kit made of mushrooms. So by the time actual villages start forming, humans had already been self-medicating for tens of thousands of years. The knowledge wasn't new. It just needed somewhere to live, a place to get passed down, refined, and specialized. That place was the village elder, or more specifically, in almost every early farming society, it was usually a woman. Every early agricultural community seems to develop the same role, even without contact with each other. Someone, often older, often a woman, becomes the keeper of plant knowledge. Which roots stop bleeding? Which bark brings down a fever? Which berries will kill you, and which ones just look like they will? This knowledge got passed down orally, mother to daughter, healer to apprentice, for thousands of years before anyone wrote a word of it down. And here's the thing people get wrong about pre-medical villages. They weren't guessing. They were running one of the longest experiments in human history. Bad remedies got people killed, and dead patients don't get their cure repeated. Good remedies got repeated for generations. It was brutal, slow, trial and error science, just without labs or peer review. But here's the problem. Trial and error only gets you so far. Herbs can dull pain and fight some infections. They can't set a shattered femur. They can't stop a birth from going wrong. For that, villages needed something closer to actual surgery. And they had it, way earlier than you'd expect. Archaeologists have found prehistoric skulls with clean, precise holes cut into them, a procedure called trepanation. And the wild part isn't that it happened. It's that many of those skulls show signs of healing around the edges of the hole. That means the patient survived the surgery, sometimes by years. Someone with a bone tool, no anesthesia, and no germ theory was performing brain surgery successfully often enough that it became a repeated practice across multiple ancient cultures on different continents. No, not because they were being tortured. Historians think it was used to treat head injuries, seizures, and pressure on the brain. Somebody figured out, purely through observation, that opening the skull could sometimes help. And they kept doing it because sometimes it worked. Here's what makes this so important. A village without a hospital wasn't a village without medicine. It was a village where medicine lived inside people instead of inside buildings. The knowledge wasn't written on a chart. It was memorized, tested, and inherited like a family heirloom. By the time we reach the first real civilizations, that inherited knowledge starts getting written down. Egyptian medical texts, like the one we now call the Edwin Smith Papyrus, describe dozens of injuries with almost clinical detachment, diagnosis, treatment, prognosis, laid out case by case. Some entries are startlingly close to modern trauma medicine. Others recommend treatments that definitely wouldn't pass a modern review board. Same instinct, though. Observe, record, repeat what works. And villages weren't just treating individuals. They were, without knowing the science behind it, managing outbreaks. Long before anyone understood bacteria or viruses, communities noticed that sickness spread faster in crowded, dirty conditions, and that isolating the sick sometimes helped. By the medieval period, this idea became formal policy. Ports like Ragusa on the Adriatic coast started holding incoming ships and travelers for a set period before letting them enter the city, specifically to stop plague from spreading. That waiting period was about 40 days. The Italian word for 40 is quaranta. That's where we get the word quarantine, from a village-level survival instinct that predates germ theory by 500 years. So villages weren't helpless. They were running public health policy with zero microscopes, based purely on pattern recognition. Watch what happens, adjust the rules, save lives, repeat. Of course, plenty of it didn't work. Infant mortality was brutal. A simple infection could kill you. Childbirth was one of the most dangerous events in a woman's life, and midwives, despite real skill, were fighting complications they had no real tools to fix. People survived not because pre-modern medicine was secretly advanced, but because humans are stubborn, adaptable, and really good at learning from disaster. Every village healer, every herbalist, every bone setter and midwife was a data point in an unbroken chain of trial and error stretching back to a Neanderthal chewing on poplar bark for pain relief. That chain never actually broke. It just eventually got microscopes, sterilization, and antibiotics bolted onto the front of it. So here's the full picture. It starts with a chimpanzee eating a bitter leaf it doesn't even like. It moves to a Neanderthal easing pain with plants we still use today. It becomes fungus in a dead man's medicine pouch in the Alps. It becomes skulls that healed after ancient brain surgery. It becomes a woman in a farming village who knows exactly which root stops bleeding. It becomes a port city holding ships for 40 days to outrun a plague nobody could see. And it becomes you, standing in front of a medicine cabinet, reaching for a pill before the headache even starts. Same instinct, same species, just a much longer memory than we usually give ourselves credit for. If you want more of these deep dives into the weird, stubborn history of how humans figured out how to survive themselves, stick around. There's a lot more where this came from.